So welcome. You wanted to learn a little bit about your nose today. Tell me a little bit about what you're maybe looking to address with your nose in terms of shape.
Yeah, I have a hump on my nose, so that really bothers me.
Okay. Are you looking to address anything in terms of the shape of the tip as well?
I would like to refine that as well.
Oh, great, great. Yeah, those are common concerns. How about your breathing? Any issues with your breathing?
I do find it hard to breathe sometimes, especially at night when I'm sleeping.
Is it pretty consistent, would you say?
Yeah.
Okay, great. Well, that's something we'll want to look at as well during the consultation. So today what we're going to do today is I'm going to examine your nose, nothing painful, just looking in with a flashlight and a small speculum, just to look at the shape on the inside. And then we'll take some photos and show you in a computer program some renderings. So for the bump on the nose, are you looking for, is there a specific change that you're looking for?
I just want to straighten it out.
Yeah, that's pretty common. There's a lot of variations that can be in terms of the curvature of it. Some patients may want a little straighter bridge. Some patients may want a little bit of a curvature, so we call it a little concavity on it. For the tip, are you looking for maybe a little bit of lift of the tip, narrowing of the tip?
Yeah, I would like a lift.
Okay, that's common, especially when we take the bump down. The tip sometimes needs to be changed in terms of position, and so oftentimes lifting it just slightly is necessary to create harmony to the nose.
Okay, and what about the recovery process?
So in terms of recovery, this is an outpatient surgery, so this is a surgery that is performed under some anesthesia, so general anesthesia. Patients go home the same day. On average, a surgery like this takes about 3 hours. Patients will leave with a cast on the nose. Oftentimes when we're changing the tip, sometimes I have to use an incision in between the nostrils, and so there'll be stitches here that stay in for a week. The first week, probably want to lay a little bit low in terms of social activities and exercise. Bruising and swelling is pretty common, so bruising around the eyes, especially when we contour the bone, when we take the bump down, is pretty common, and that's normal. That bruising usually peaks out about 4 days, and it settles down. So a week later, we'll see patients back to take the cast off and the stitches out. At that visit, patients will get a peek of their nose, but I have to tape the nose again after that visit, so the nose will be covered for a total of 10 days after the surgery. By 2 weeks, most patients feel pretty comfortable to go back to work, see friends. There'll be some swelling that's expected, but for the most part, most patients feel pretty comfortable at 2 weeks.